Details tonight on how doctors are using Valley Zika cases to formulate a better treatment plan for future patients.
Channel 5's Taylor Winkle has more on a recently released study.
The study identified 18 pregnant women from December of 2016 to May of 2017. They had test results indicating they were infected by the Zika virus. Health professionals we spoke to today tell us there's still a lot that's unknown about the virus. Scientists say today diagnosing congenital Zika is difficult. If a woman is infected with Zika during her pregnancy, doctors don't know how to determine if that baby will have birth defects. The best thing the CDC can recommend is taking preventative measures and planning when to start your family, according to Paula Saldana, a lead patient navigator for Planned Parenthood in South Texas.
If the person is seeking to get pregnant, they need to be aware. They need to be looking for ways to prevent the mosquitoes born around the areas that they visit. They need to be aware of any signs or symptoms, and not just the person, but their partner as well.
I mean, it's something I definitely thought about after I got pregnant, but not while we were planning.
Stephanie Schumann is a soon-to-be mother of 3. She's 18 weeks along with her 3rd child. She tells us feelings about Zika vary between the moms she knows.
Some moms are definitely more concerned than others, and some moms are just, maybe they just don't know enough about it, or, they just assume that it was from a couple years ago and it's all over.
Medical professionals say it's far from.
I feel that the part where it's sexually transmitted needs to be more talked about.
Schumann tells us she didn't take the virus into consideration when she was planning her 3rd child.
It wasn't as big of a concern, but it's still in the back of my mind. Every time, I see an ultrasound, I'm like, is the baby's head okay? Just natural concerns, I think.
The study describes 2 infants evaluated for Zika after they were found to have microcephaly in the womb. The first baby was born to a 23-year-old who spent the first 4 months of her pregnancy in Matamoros before moving to Brownsville. She didn't have symptoms of Zika, and her fetus didn't show any signs until she was 36 weeks along. The second baby was born to an 18-year-old who lived in Brownsville but traveled weekly to Matamoros during the early stages of her pregnancy. She didn't show any signs of the virus either, but screened positive for Zika at 23 weeks. Something no mother expects, but Schumann says more moms need to look out for. Many medical centers around the valley are screening for Zika and asking pregnant women about their travel habits. They're also asking women to look out for any symptoms of Zika. The most common include fever, rash, joint pain, and red eyes. When there's a history of travel to an area with Zika virus transmission or clinical symptoms, doctors look for microcephaly and a test for Zika is performed. Reporting in the studio, I'm Taylor Winkle, Channel 5 News at 10.
The CDC has lifted a Zika-related guidance alert for the Brownsville area, but Brownsville and the southernmost areas of Texas are specifically mentioned on the agency's website as places where mosquito protection is a must. A reminder now of how Zika spreads. This is a Channel 5 News Extra. Mosquito bites continue to be the most common source of transmission. A pregnant mom can also pass the virus to her unborn child. Infections due to blood transfusions and unprotected sex have also been reported.